Hi, I'm making this video to tell you about my surgery tomorrow. Tomorrow I have a thyroid surgery. They're going to take out the left side of my thyroid along with a thyroid nodule. I have hypothyroidism, and I found out that I had a nodule on my thyroid, and so I saw an endocrinologist, and she scheduled me for a biopsy. Now, whenever she scheduled it, she told me that if it came back inconclusive, I'd have to have surgery to take out the nodule plus half of my thyroid. Well, I had the biopsy, and that's what happened. It was inconclusive. She said that if I do have cancer, it's what they call follicle cancer, and that since I do have hypothyroidism, it's caused by Hashimoto's disease. She was able to find out that from the needle biopsy. She set me up to have surgery with a surgeon, and I had my consultation with him. And one of the purposes of the video is to let you know some of my concerns and perceptions and expectations, and then tomorrow after the surgery, hopefully I'll be able to make another video to show the reality of it versus the perceptions and expectations. Let me put my glasses on so I can read my notes. Some of my concerns after having the consultation with the surgeon was, of course, there's always some apprehension or fear, I guess, of having surgery. Of course, in my case, I have no conscious fear or apprehension, but I guess subconsciously I probably do. The doctor said that the greatest risk of the surgery that I'm going to have is bleeding. Now, the video that I have seen on YouTube, most of the people that had the thyroid surgeries, they had a drain in their neck or their chest, and also they spent the night in the hospital. Well, mine's a little different. I'm not going to have a drain, and it's day surgery, so the surgery should last 45 minutes to an hour and a half, and I should be in the recovery room for about 30 minutes, and then sometime shortly after that, I can go home. But as far as the bleeding, the doctor told me that he's going to make sure that I apply ice to it on and off. If I leave the ice on there, it'll cause frostbite, and that'd be bad. But that way it'll constrict my blood vessels, and it'll keep me from bleeding so much. One of the concerns that I had was I understand there's some little bitty glands called parathyroid glands. You have about 4 of them, hopefully. And it's a little bitty pea-sized gland from what my research tells me, but supposedly it's very important to your heart as far as calcium to your heart. But the doctor assured me that I have at least 2 on each side, and so that shouldn't be a problem. Now, some of the YouTube videos that I watched of people who had this type of surgery, they explained how painful it was, that even a morphine couldn't control the pain. Well, I don't expect to have that type of pain since I'm just having half of it taken out, and it's day surgery. I'm allergic to hydrocodone, so the doctor said he'll prescribe Tylenol 3 for me, so I hope to have that. And of course, one of my concerns is, are my parathyroid glands, even if they're not damaged, are they going to be shocked by the surgery, and will I have to take calcium and possible vitamin D for a few days to compensate for that? Another risk, he said, was voice hoarseness. He said my voice is going to be somewhat hoarse after the surgery for a day or so, but there's a risk that it could be permanently hoarse. And of course, I hope that didn't happen. I'm ready for tomorrow. My wife's going to take me, well, actually, she's not going to take me. She's going to ride with me to the hospital, and after the surgery, she's going to bring me home. I stocked up my refrigerator with dairy-free yogurt. I'm lactose intolerant, but I have some dairy-free yogurt. I have some pudding. I had some Jell-O, and I bought a lot of sherbet and some instant mashed potatoes. So on the food level, I should be fine. I understand that tomorrow the last season of Nikita comes out on Netflix, so I intend to watch the whole season over the next day or two. So they'll give me something to do. So hopefully tomorrow, after the surgery, I'll be able to answer some questions. And of course, the picture's worth 1,000 words. You'll be able to see how I look. Do I look horrible? Do I look like I'm in pain? Do I look normal? But some of the questions I hope to answer tomorrow is there pain in the back of my neck? Some of the YouTube videos, they said that because your neck had been extended for the surgery, they had pain in it. Hopefully that won't happen to me. In some of the YouTube videos, there was bruising all above the incision because they had to pull the skin back, but hopefully I won't have that problem. The surgeon explained that he has to cut a muscle when he makes the 4 centimeter incision, and sometimes it swells real big. So hopefully I'll be able to answer whether or not that's swelling a whole lot. One important question that I hope to answer tomorrow is Tylenol 3, is it going to control the pain? And of course, there's no such thing, I guess, as a routine surgery. The big thing is, are there going to be any complications from the surgery? And of course, a lot of the research says that with this type of surgery, very seldom are there any complications. So I think I'm fine about that. And of course, if I have cancer, they won't know for sure for several days after they do the pathology. But one important thing that I noticed on the YouTube videos I've seen is that with a doctor's trained eye, he should be able to tell us what he thinks. Does it look good or does it look bad? I have a lot of confidence in my endocrinologist and also my surgeon, and I'm looking forward to feeling better several days after the surgery. So I'll let you know tomorrow how it comes out.